Hi everyone, this is Mrs. Markle. This recording, it will serve as a review of content for the community portion of the course, starting with week 5 content. Just as you're going through, to note that these slides are through the ATI Engage series, so the content is copyrighted and through ATI, property of ATI, and it will serve as a good resource to support our learning as we work through the next 2 weeks of content. All right, so first, what is a community? Things to note. You have a collective group. It could be within the same geographical location. There could be some similarities, such as sharing culture, religion, ethnicity. Looking at from healthcare perspective, maybe a group of individuals who share similar health issues or socioeconomic circumstances. Client can be either community or population, not always necessarily the individual, looking at more as a whole. So, what are some goals of community health nursing? We want to find ways to help promote health and welfare of clients. We're going to be working with clients from diverse populations, diverse areas, as well as different ages throughout the lifespan. So, next week we'll talk about aggregates and what that looks like for care. Community health nursing is very broad. There could be a wide variety of settings that you might see community health nursing, such as like hospice, home health, ambulatory cares, um, prisons, outpatient surgery centers, occupational health, school health, public health within cities. So those are just a couple examples. Community health, though, is something that will affect everybody, no matter what level of nursing you end up finding yourself to be when you start working. Every individual is going to be affected by non-medical concerns, and that's going to have a direct effect on their health. And we need to have a better understanding of what those non-medical effects are so we can address them, we can recognize them, and support our patients with available resources. Um, like I said, goal for health, promoting health and wellness. So when we look at levels of prevention, priorities being at primary level of prevention, we're trying to prevent the illness from even occurring. So we want to support our patients with being able to find like primary care providers to be more, we want to be more proactive and preventative versus reactive if there's like an emergency that occurs. But if you're in the hospital and you're working with patients, discharge starts at the time of admission. And discharge is going to be affected by a lot of factors, right? We can't just provide the patient with papers and send them on their merry way. We need to ensure that all those influencing factors are addressed, are identified, and the patient can safely go home because we want to keep them out of the hospital. So there's a couple different types of nursing within the community. We'll hit on public health, and again, looking at that health promotion, disease prevention. Community health, health promotion within a specific area, population health, looking at specific needs of specific patient groups. Population health nursing is going to help assist clients in managing health conditions within their community. And big thing we need to know is how can we help coordinate care and how can we help connect the client to those community resources? Overall goal is to help improvement in quality of life. Community health nursing can take more of like a holistic approach. When we're looking at like key principles of public health nursing, we have, like I mentioned, emphasizing primary prevention. We want to work to achieve the greatest good for the largest number of individuals. The client is a partner in their health, so they do hold some responsibility in their health and their health outcomes. And we want to be wise about how we connect patients to resources, how we choose those resources, and goal is advocating for our clients, so they can take an active participation piece in their health to help promote better health outcomes. So, looking at community health nursing a little further, we have goals. We want to decrease health inequities. We want to address social determinants of health. And like I had mentioned earlier, here are some practice settings. I think I did not mention churches, but the other places were noted. And you can see that each one of these can have an impact on the community that they serve and where they are located, and can each have specific needs for health as well. So, when looking at ways that we can decrease health inequities, we first need to understand what are health inequities. And really, it's unequal care, and they could end up being factors that can threaten one's health. When looking at health disparities, these would be differences in like how can the patient access available services, what's their overall health status, what's the influence of maybe their environment and their family. Um, and looking at those differences that could have direct effect. And as nurses, we want to be aware if there are health disparities that are present so we can intervene when needed. And one piece of community health, they reference evidence, and a lot of the evidence comes from looking at and reviewing social determinants of health. And looking at social determinants of health, we need to understand what is the Healthy People Initiative. So we're in the Healthy People 2030, and they have a goal of eliminating disparities and those inequities to help achieve equal care for all. So looking at essentials of community health, those determinants of health, these are factors that are going to affect one's health. So it could be client factors, it could be environmental factors. Um, they could include impact of education, housing, finances, um, access to food, proper nutrition, looks at like genetics, biology, and also influence of like family health practices. And looks, how does that affect one's health? How does that affect one's idea of health? And how does that affect their how they're going to seek help or try to treat issues that come up? There are core functions of public health. And we want to assess. So we want to know like what's present, what are the issues of our community members, not just like the issues that we feel are needed, but we're going to gather that data. A lot of this could be done through like windshield surveys, maybe surveys with community members, interviews with community members, sharing town halls, having community centers open and available, um, with different like health tips and tricks, and then just having that general conversation with health member or sorry community members to understand like what do they see are the needs um, growing around them. um, you also want to take into account like policy development, so I'm working within the community public health, how do we help in the development of public health policies, how do we help to collaborate with lawmakers because change takes time. um, So you want to support and elect individuals who have similar ideas and um, thoughts and, goals for the community in general as what you do to help see that change be done. Here I'd mention Healthy People 2030, and these are based through The it looks at trends, looks at data, and it's connected with the U.S. Department of Health and Human Services. And a big piece here is helping to influence public health policy through collection of evidence, through data, looks at trends, and it's reevaluated every decade. Um, Looking at health promotion, healthy people can help measure quality of health. It can help nurses to look at, what strategies are going to make the most impact for both individual and community health. Um, Healthy People 2030 initiatives can also help improve the length of a client's lifespan. And if we help to also get like active involvement of community members to help make changes within their lifestyles. When we think about like optimal health, this can be both physical and psychosocial. And we want to help support those more preventative services. So a lot of that comes down to health education, health awareness. It can be some counseling based on, healthy lifestyle changes, um, how to seek preventative health, immunizations, and also looking at how can we screen if you have at-risk populations for certain diseases. So, as mentioned before, as nurses, we advocate. We are the client advocate within the community health. We're going to listen, we're going to support, we're going to help the patient make an informed decision of their health. We can also serve as the bridge between different entities within the healthcare team. The clients are a partner in their health. They should hold some responsibility for their own health. So, we're going to help advocate for resources and services that help meet the needs of the client, but then we're also going to advocate that the patient ask questions and, like I said, make sure that we help the informed decision process, but then we also want to respect their autonomy. And, patients do have a right to say no. They have a decision to make the right to make a decision that may not align with your own thoughts and wishes. So we do have to respect their autonomy, but we do need to advocate for their healthcare needs and available resources. So when we're looking at like examples of what this might look like, providing education to make informed decisions, speaking for clients if they're unable to do so, we're going to help provide those community resources. Or if you're working within looking like with occupational health, looking within the workplace, looking for safety for workers, um, specific to communicable disease? Do we have appropriate PPE in place if something were to occur? Communication skills. This is going to allow nurses, we want to assess both verbal and nonverbal communication, take in their body language. We want to ensure that we're advocating appropriately, but if there is the impact of like cultural differences, language barriers, are we using the right resources and being sensitive and respectful to those needs as well? Communication is also important for the professional setting. When we talk about case management, interdisciplinary team communication, and looking at holistic care of the patient to get them out of the hospital, you want to ensure that communication is effective. Effective and professional communication can help to reduce costs in the healthcare system. It can help reduce med errors. It can help involve the client and their family into decision making, and it can support the patient, make them feel supported and vulnerable that are willing and able to adhere closer to the treatment plan. So, looking at the impact of nursing with health policy, nurses do have a big influence on health policy, and there's a couple ways that you can get involved, or you could be a change agent. So, looking at, what changes are needed, local, state, federal, advocate for those needed changes, communicate with stakeholders and policymakers. You can help to influence legislators by participating in the professional nursing associations, and those professional nursing associations support specific changes for nursing. They look at the evidence and they participate in like the lobbying process. So that would be maintaining active membership in those professional organizations. You can collaborate with other groups of healthcare professionals, and you could also look for ways to serve within like a public office and advocate from that avenue as well. So let's break down the social determinants of health a little further. And these, again, are external factors that are going to influence health. Um, there are, ATI is going to break it into six different categories. Um, but in general, there are five categories, and the goal is to understand like what are those preventable differences, what is a burden, what's influencing rate of disease, injury, violence, how can we help patients achieve optimal health, and especially serve those who may be socially disadvantaged, who are vulnerable, and who are at a greater risk for poor health status, for individuals who might have limited access as well. So these are the five categories. And again, just the same thing, breaking it down. So let's look at each just a little further. So first, we're looking at healthcare access and quality. So a big piece here is going to be looking at health insurance and do they have coverage? When looking at like goals for primary health, uh, you want to ensure that it's available within like closer proximity to all individuals. It could be flexible in cost, and that individuals are going to utilize those services that are available. And looking at trying to make like a shift, trying to shift more primary care measures versus acutely treating a disease process to help to, if we can prevent it from occurring in the first place, that's going to help to decrease healthcare costs as well and help kind of like level the um, health equity for our patients. So because there is a concern of rising healthcare costs and individuals, there's been an increased use of emergency departments as primary care, whereas COVID pandemic did highlight disparities that were present, especially individuals who are like have a lower socioeconomic status or living in an area with less resources, who are marginalized, had higher mortality rates to the pandemic because of lack of resources. Another piece would be for those who live in rural areas, there is, because of the distance, could be a lack of primary care providers in general. Um, Transportation is going to be a big issue here. Just the distance to get places when you're living in a rural area can be limited if no transportation and limited food sources as well. Another piece here could just be a lack of understanding or lack of health literacy. Language barriers can impact health literacy. Um, it could be too, like, how did the patient grow up? What was their overall, like, family influence on health? How does their family view health? How do they view um, health treatments? And really, you want to be careful when you talk about compliance versus non-compliance with patients. because a lot of times non-compliance may not be the original issue, and there's other influencing factors that make it difficult for the patient to fully comply, but you need to address those issues. You don't want to just write the patient off as being non-compliant and think that they don't care. So you do want to make sure that what's their primary language, what's their primary level of learning, reading, and how do they learn best? Is there somebody else there with them that can help to take in some of that information? So looking at strategies specifically to like financing for healthcare, of how we can improve healthcare access. Financing can come from several different avenues and different sources. You have the Affordable Care Act, um, Patient Protection Affordable Care Act. This was created to help make health insurance more affordable for all individuals and to try to decrease federal spending on health. And um, this is available through the U.S. Department of Health and Human Services website. Um, with this, it helped to extend eligibility. You know, dependents could stay on parents' insurance till 26. It helped to decrease benefits getting denied for pre-existing coverage for kids under 19, and it covers those preventative care services. There are other pieces such as Medicare, Medicaid. Medicare is going to cover individuals who are older than 65 or younger than 65 with a disability. There are different parts of Medicare, and it looks at like different resources. So, like, Part A is more like if you have to go into the hospital, if you have to be placed into like skilled nursing care. Part B looks at more like specific services, outpatient care, home health, diagnostics. C is more private, and it's a combo of A and B. And then D looks at specifically like prescription medication coverage. Medicaid, so this would be insurance coverage for individuals of lower socioeconomic status and kids. Eligibility is based on like household size, income, and excuse me, it can give a variety of services, but this would be something that you definitely would want to look to like social worker, care coordinator to help the patient set these up. Other things, we can also engage in telehealth, so like virtual healthcare to try to reach patients who may be at an area that is further distance, or is there presence of like community health centers within communities, and within these health centers, we can try to improve access to like screenings, like healthcare screenings for like blood pressure, diabetes, your cholesterol. It could gauge more primary prevention education, so like for new parents, for kids' safety. Um, so that would be another way to expand the coverage and try to reach more individuals. Next, we have education, access, and quality. And this is specifically going to look at individuals who do receive quality education. They have a higher chance of making a livable wage. They'll have improved access to healthcare benefits down the road. They can make better healthcare decisions for themselves and their families. There can be more positive health outcomes, have a better um, understanding, better idea of what positive health looks like. Lower levels of education can be more associated with poor health outcomes, higher level of stress. Um, Vulnerable patients are going to be directly affected by lower levels of education. Um, and due to that, then as well, you may also see a decrease in income down the road. Here you can see poor quality schools. Could you could see more prevalence of like violence, bullying, could be a higher student to teacher ratio, might be lack of student nurse or sorry, school nurses. So there might be higher presence of like behavioral and mental health concerns for your like children and your adolescents. School funding comes from property taxes, so if the schools are within an area of a lower socioeconomic status, their funding is going to be less. So the funding is going to be spread thin when you're trying to think about all the priorities that do come along with education. So what can we do to help improve education? Try to support and advocate that there is adequate number of school nurses because this is a means of um, school nurses can help to address some of those vulnerabilities. They can identify needs that are present. Try to ensure that there's school-based mental health services. Next piece being economic stability. And looking at economic stability, this is going to be directly related to how much access does an individual have for resources, such as finances for a living, housing, food, and can they find a job that provides like a livable wage? There's rising unemployment rates and there's a increased incidence of poverty. This can have a direct impact on food insecurity as well, like understanding for an individual when their next where are they going to find their next meal. Extreme poverty can lead to inadequate housing. It can also increase the risk of homelessness. And then if you have an individual who is finds himself homeless, if they don't have a regular place to residence to stay, then you start to have the risk of um, impaired health care. So individuals can be um, they are not may not seek more preventative care. Now they're going to seek care in times of need where they're having like an acute exacerbation of a disease or like a crisis. So resources are going to be higher and acuity is going to be much higher and the outcomes could be decreased. There could also be a lack of access to transportation for individuals to get to where they need. Um, Looking at strategies to help improve economic stability, looking at training programs, career counseling within schools, child care services that are still of a higher quality but more affordable. Can we connect individuals who are in need with like food stamp programs, WIC, CHIP, and looking at more affordable transportation options for um, adults to be able to get to their place of employment. Next piece is going to be our social and our community context. And this is going to look at impact of cultural competency. And um, with nursing, this skill of cultural competence is going to develop over time. You want to learn how to respect your patients. You want to provide them with the dignity that they deserve in their care, providing preferences that are going to align with their beliefs, and being respectful with what impact this may have on their health and their health choices. Other things, impact of social and community context could be kids living with incarcerated parents, if there's the presence of like a dysfunctional family unit, if adolescents and kids are experiencing bullying and violence within school, and the risk of rising STIs in adolescents pregnancy. So things that could be done. Let me see here. Find ways to help promote more positive family relationships. Find ways for mentoring, whether this be Do like after school programs. Here's an example of like the Boys and Girls Club of America. Um, after like extracurricular activities with sports in schools, or are there programs within school or community centers of how to prevent STIs, or there's support for adolescents who find themselves pregnant to help them make best choices for their health and the safety of themselves and also their babies. And then also ensuring that there's availability of like support groups and counseling. And this could also, if patients find themselves in a time of crisis, do they also have access to emergency housing, financial assistance, um, and support for each of those needs if possible. Then we have neighborhood and built environment. And here we're looking at, everything that surrounds the patient wherever they are. So things such as like quality of air, land, water, looking at all the other surroundings. What are you going to come in contact with when you're where you're living, where you're walking, where you're engaging? It looks at can look at like structures themselves to like the infrastructure. So the safety of like presence of mold, asbestos, lead, um, outside, like when talking about like the water and the air quality, like the impact of air on like respiratory illness and also risk for illness for kids. So other things when we look at as for the nursing perspective, it can also look at like accessibility of transportation within the area. It looks at grocery stores. It looks at the impact of like food insecurity. Do those places sell healthy foods? Um, Noise, that's another piece because that could have an impact on sleep health. Um, Impaired sleep can have a direct impact on like chronic health conditions, mental health, like secondhand smoke, and also like occupational hazards. So when we look at how do we collect the data, there's a couple, and I had mentioned this previously, but there's a couple things that you want to do when you're looking to assess the community. You want to define what is the community, who is your patient that you're working with. And then we're going to collect the data. So that data can come from interviews, community forums, observations, focus groups, surveys, windshield survey, where you're actually like it's giving a windshield survey gives a very descriptive approach of the community. You're driving through the community. You're assessing everything that you see, don't see, looking at all the different components that make up the community, the infrastructure itself, social systems. Um, and then we want to analyze that data. And before planning programs, you analyze the data, you know what's available. You plan programs with community members, you try to implement them, and then you're going to evaluate like what's the follow-up? Did the community members appreciate or did it improve? Are they engaged with what's going on? But you do want to include the community in the planning process when you are looking to make a change. So next, let's look at overall like disease prevention. Okay, levels of prevention. And in your books, page 8 is going to give a just a brief description. It breaks it down primary, secondary, tertiary. Primary is the largest second at the bottom of our tiers because we're targeting healthy individuals and the goal is to prevent illness. We're trying to prevent even the initial occurrence of like injury or disease from occurring. A lot of this starts with like um, education, immunizations, hand hygiene. Um, can also look at like, can you advocate for access to healthcare for the patients? Can you advocate for a healthy environment for patients. Those would be examples of primary prevention. Then you have secondary prevention. Now we're trying to target who's at risk for the illness. We're trying to early detect so we can try to limit adverse effects from occurring. So examples here, a lot of screening, blood pressure screening, STDs testing, cancer screening, heart disease risk, diabetes, looking at like sensory impairments, and then also they can look at like um, infrastructure risk too, so like lead testing um, in kids, and then also screening for like respiratory illnesses. And then tertiary prevention, you are now working with individuals that have health conditions, and you are trying to promote safe rehabilitation for them. You're trying to help minimize further complications, trying to maximize the health that is left. So things here is, think about like a patient who experienced a stroke. There's a lot of different therapy levels of therapy that are going to be involved with their care. Occupational therapy, physical therapy, speech therapy, um, podiatry as well, especially if you have a patient who like is living with diabetes, case management to help support the patient and also their family and whoever's helping to take care of them at home, support groups for both the patient who's dealing with the disease, but also like respite care and support groups for caregivers. We already went over this, but it just again highlights differences between the centers when looking at centers for Medicare, Medicaid services, Medicare versus Medicaid. There are a couple trends that you want to make note of within public health nursing, big one being technology, and technological advances have really helped to diversify like how healthcare information can reach individuals, especially through like telehealth, telemedicine, virtual care visits. Um, but it can also have some cons. So you want to assess the vulnerabilities of the patient, but there is a strong trend upwards of the use of technology. Aging. People are living longer. There's a presence of more chronic illness. There's more money involved, increased spending. Provide like specialty providers might be limited, especially within specific areas. And then looking at like quality of life, at end of life ethical issues, like trying to incorporate the use of like palliative care, more holistic treatments, and also looking at um, the impact of like hospice care as well. Other things that could have an influence on health, work workforce shortage. So there is an increased need for population health nurses, medicalization. People are taking more drugs, and maybe there's a less influence, excuse me, on like preventative health lifestyle changes, but increased use of meds. Is there now the risk of like polypharmacy? How's that going to influence, especially like our older adults? Um, and then you want to take the focus back to those social determinants of health to help address those inequities that might be present. Some things that could be affecting global health, climate change, so the effects of our environment, food insecurities. So we want to support different programs, SNAP and WIC. This was increased. There were increased issues noted with the pandemic due to like lockdowns, shortage, and then also, where does the patient live? What's available within their little radius? Is it more convenience stores down on the corner of the street that have processed packaged foods? Or do they have access to farmers markets, larger grocery stores that have produce? Then human trafficking as well. Um, there's a lot of underreported cases for human trafficking, and this would be important for this, especially like if you're working like primary care or in the ERs to be able to have the effective like screening process to identify any of the red flags that might come up with your patients if you note signs of human trafficking. Other concerns that can have a direct effect on health, racism, so the effects of violence, and how this impacts health disparities, other violence, domestic violence, gun violence, and then the global pandemics. So now let's talk about epidemiological triangle a little bit. So epidemiology is important. It's used to look at trends of disease within areas. Um, when thinking about like communicable disease worldwide, millions of deaths a year are associated with communicable disease. So community health nurses need to have a understanding of like what influences that risk, what influences like modes of transmission, um, what does it mean for a patient to be have that like increased communicability, and how can you intervene with all of those levels of prevention that we talked about. A big piece looks at fact like the influence of different factors. So the epidemiological triangle, it looks at relationships, and there's interactions that help to determine and influence risk associated um, with disease. And so, depending on the factors, it can increase or decrease risk for disease. So, different factors here, we have the agent, we have the host, and then we have the environment. Mm. So, looking at first the host, so that's the individual. There are things you want to think about for your host. How susceptible is the host? Um, so, things that could influence susceptibility, age, sex, genetics, ethnicity, where do you work, um, your baseline health status, and then also like your immunological status. Like, do you have your immunizations, or are you living with a disease or a health condition that will put you at a higher risk or a higher susceptibility if you were to come in contact with an agent? Agents, then you're being exposed to something. So there could be chemicals, they could be infectious, so like virus or bacteria, or it could even be like a physical agent, like I had mentioned earlier, noise, but then also temperature as well. Temperature, that would be a big one, especially for our vulnerable patient populations are experiencing homelessness. Individuals who do not have a routine place to stay are going to be at a higher risk for exposure to temperature related extremes. So, like extreme cold, extreme heat, what can that do to one's health? So, now we have the risk of like hypothermia or risk of like heat stroke, dehydration, and then the environment. So, what's surrounding the host themselves? So, it could be physical or social. So, physical aspects are more looking at the infrastructure, like what's available for like food and water. Do you have the presence of vectors? So like vectors would be like ticks or mosquitoes. Those are two big vectors. Um, reservoirs related to vectors would be like large bodies of standing water, stagnant water, or for ticks, like large woody areas or high grassy areas. And then you have the social environment. So this looks at socioeconomic status, so their finances, risk of poverty, if they work, what kind of conditions are they working in? So their occupational hazards or health, and then do they have access to health care? There are natural and built environments. Natural is more of soil, water, atmosphere, bodies of water versus built is more your infrastructure, how you are transport, how you sorry, your transportation, where you're driving, um, buildings that you're in, air and water. So, air pollution can cause respiratory illnesses. There is an air quality index, and especially on like the weather app, it does give like daily air quality index indicators for you, so that if you do have a your higher susceptibility for respiratory illness or you have pre-existing issues, gives you an idea of like maybe stay inside. Water pollution. So a lot of this is looking at like this is the presence of like runoff of if you are near farming areas like pesticides, herbicides, or in an area that has a lot of like animals, or areas that do not maybe um, like sewer treatment areas, or don't look at like that waste, or it's not being done properly. Now you have the risk of bacteria parasites that can cause GI illness. Some strategies to help improve environmental health look at smoke alarms, how to prevent drowning, forest preservation, immunizations, education. As a nurse, things we can do, go back to windshield surveys to assess like if those environmental factors, what's affecting one's health, what's near, what's around them. There are some things that attribute to major public health problems. One being communicable diseases, and these diseases can be waterborne, foodborne, sexually transmitted. We want to know populations at risk. So these are our young kids, older adults, clients who are immunosuppressed, clients who have a higher risk lifestyle, healthcare workers, or people who travel a lot. Looking at modes of transmission, could be airborne, foodborne, waterborne, vectorborne, direct contact. So when looking at the chain of infection, you have an agent, something that's causing the issue, causing the disease. And it goes to now you have a susceptible host and your reservoir. So first you have your reservoir. This could also be like a vector. How is that causative agent going to be transmitted? It's kind of it houses the agent. So then that if it's an individual with like an airborne disease, like measles, measles is an example of it's transmitted, it's airborne. So you have portal of exit. How is that agent going to come out of the reservoir? Is the individual going to cough, sneeze, even just speak, and droplets coming out of their mouth? So that could be your mode of transmission. Or maybe it's placed onto like something that's highly trafficked or used by a lot of people. So now someone else is going to touch something, like a direct contact, and now they have it on their hands, and their hands go to their face. So now there's a portal of entry to eyes, nose, mouth. Or maybe mode of transmission is airborne, and the portal of entry for the individual is they're breathing it in because it's airborne. And the droplets are kind of hanging out in the air for a period of time. And then based on the susceptibility of the host, looks at how significant of a reaction they uh, may receive. Another big public health problem be our chronic illnesses, such as cancer, heart disease, diabetes, risk of substance abuse, and then acute injuries from things such as like firearms, suicide, drug overdoses. Oh, yeah, we talked about this, right? Chain of infection. So it identifies and to help prevent communicable disease, you have the agent, transmission, and the host. And then this just talks a little more detailed about the agent, host, and environment, so you can read them. I'm just going to go through them, but again, you can read them. We talked about this, risk factors for host susceptibility. Are they immune? Do they have age extremes? What's their overall nutrition, genetics, and environmental factors? We talked about modes of transmission. So how does the agent travel? Direct, indirect. So direct is it's being transferred directly from a reservoir to a host. Indirect, it uses something in between, like a vector, so like a tick or a mosquito. So that would be indirect transmission. But directly would be it's directly from the reservoir to a host, so like your common cold, HIV, tetanus. Whereas examples for indirect, tuberculosis, Lyme's disease, malaria, dengue fever, especially in like with the World Health Organization, some of those third world countries. The West Nile virus, that's another one. I feel like last year there were a couple pockets of West Nile virus going around close areas. Then you have communicable versus infectious. So infectious, the disease is caused by a pathogen versus communicable disease is spread from human to human. And CDC does have a reporting system for diseases. So if you fear that there is a possible exposure to something or you note an outbreak, you do need to report it, Department of Health, so it can follow the respective reporting system and also follow the respective process for reacting to that. Chronic illnesses, leading cause of death and disability in the US. So prevention strategies should be in place for things such as smoking cessation, healthy diet, exercise, limiting alcohol, regular screenings, and adequate sleep. When understanding vulnerability of our patients, there are going to be resulting from individual and social factors, and there are populations that could have multiple risk factors for negative health outcomes. You want to identify modifiable risk factors for your clients and try to come up with interventions and goals for them to address these. There can be factors that threaten one's health. We've talked about a bunch specific to social determinants of health. Um, and there are other individuals who are subject to other issues, um, such as violence, substance use disorder, mental health concerns, poverty, and homelessness. And these health disparities are going to cause differences in one's health status and access to healthcare services. So we want to help to create a rapport with our clients, help to provide a safe environment. We're going to help to coordinate services between the patient and the providers, and we want to advocate focusing on more preventative services for them. With the client being should partner in their health, and they do have a responsibility piece, we want to help them gain control back over their health and their healthcare decisions if possible. This is going to reinforce the social determinants of health again, and you can just read them since we've talked about them. But again, make sure you're looking at them. Nurses' role within vulnerable groups. We're going to advocate for equal treatment despite the societal factors or things that could threaten one's health. We're providing culturally sensitive care. We're being respectful, and we're addressing those social determinants of health that are present. We have When looking at specific groups, we have our veterans, and risks associated with our veterans could include depression, PTSD, anxiety, chronic pain, There could be an increased risk for substance abuse, physical diseases, mm, somatic complaints, depending on their chronic pain or if there's a significant injury that they did obtain while serving, such as like an amputation. They do work with the Veterans Affairs healthcare system to ensure that access is available for all veterans. So for nursing, when working with veterans, we can help to coordinate referrals and try to be the bridge for those veteran services through the VA. We want to ensure the continuity of care is found between acute and outpatient settings and help develop those partnerships between providers as well. Um, it can, from my experience, it can be a little difficult because there might be like limited providers available through the VA, and so could find it just a little difficult to find availability that meets the needs for your clients at time of discharge, especially from like the inpatient setting. So just being aware of that the patient would benefit from the VA services can guide conversation with the doctors at discharge. Our LGBTQIA plus populations, things that could be common here, depression, anxiety, with some other risks associated to substance use, STIs, suicide. Um, Individuals can face barriers for adequate health care. They can face a social stigma, discrimination. There could be a risk for health disparities, even just related to lack of understanding and knowledge of healthcare providers or lack of healthcare providers that provide like the skilled care that is needed for the our patients. So we can help to advocate for increased access to care. We can help to support um, active involvement of their support in their family and their care. We can help support like safe environments for patients to discuss their care needs and concerns. And we want to try to help improve um, patients who have a routine healthcare provider that they can trust and continue with that continuity of preventative care for them. Adolescent pregnancy, there's a higher risk to moms and babies. There might be a lack of prenatal care. Uh, Mothers might be within the foster care system. Um, Other things that could be present, like high blood pressure, risk of premature birth, low birth weight with infants. Um, so there is, as nursing, we can help to assist with early identification and trying to early initiate the prenatal care and help provide resources with pregnancy counseling. Um, and help with applying for more like assistance programs. So that'd be like the WIC or prenatal services, and that can also help promote education. Incarceration, um, mental health concerns are going to be common within prisons. Healthcare will be regulated through the Department of Justice for incarcerated individuals. There is an increased rate of chronic disease within incarcerated patients. There's other risk factors like violence, crowded living conditions, limited treatment options. So think about like the risks associated with like the communicable disease. You do want to make sure that you maintain professionalism and care without that unconscious bias, right? Treat everybody with um, equal care and lack of influence of your own thoughts. Um, And a big thing too is if patients who are incarcerated, if they are able to be released, a, a big piece would be supporting that transitional care to help reduce the risk of future violent behavior and future like re-incarceration. So things might have to be in place with like community mental health centers, um, follow-up care for medications that were started maybe in prison, and also that continuity piece for primary care providers and help with work and help with housing. Homelessness, we've talked about a little bit. Those are just things that individuals who find themselves homeless may have a higher risk or higher rate of. And then our rural populations. This would be for individuals who are living within a further distance, more of a rural area. So there could be a higher poor perception of health or functional status. There could be a higher incidence of chronic illness, less likely to seek health care, potentially due to transportation, distance, availability. Telehealth could be an option, but you do want to make sure that they're still being seen in person intermittently. And you do also want to make sure that there is the ability to have internet services to seek the telehealth option. So, access to care will be a big piece of advocating for clients who live within rural areas. And there are migrant populations. There are risk factors for poverty, limited access, hazardous working conditions, lack of regulations. The focus is going to be on like infection prevention. Often patients um, may live within crowded spaces. Um, and there might be like temporary housing within a specific location. So you do want to ensure that you're being mindful of cultural sensitivity, cultural competency. Um, Care is individualized for the individual. We're trying to consider some of those barriers, such as like language barriers, impact of bias. There might be a fear of like deportation if you have workers who are undocumented, and you want to focus more on preventative measures whenever possible, most likely taking the care to the patient as well, wherever they are. And then the last piece to talk about a little bit here is health education. So we want to consider learning styles. How does the patient learn best? It could be one of these, it could be multiple, right? Think about how you learn and what works best for you. It's going to be individualized, so we don't want to assume. We need to ask, are they more of a visual learner? Do they need to see the content? Are they more auditory? Do they need to hear the content? Or are they more hands-on with tactile? Could be, again, a combination depending on um, what fits their needs best. There's different domains. So, different areas within the brain that focus on how learning is, how it occurs, how it's retained, how you analyze, how you remember, and then how you apply it. So cognitive focuses on how the learner is going to be thinking and looks at overall development of knowledge and the skill. Affective focuses more on how you like feelings and how you value health and health education. Psychomotor is more of like how do you apply what you've learned and looking at those sensory motor skills. Health literacy, this is a huge piece that we want to always make sure that we are assessing with our patients. Health literacy is the ability to obtain, understand, and make health-related decisions. There can be risk factors for poor health literacy, specifically when working with patients who are older adults of a lower socioeconomic status and who may be medically underserved. We do not want to assume just because if you're working with an individual of either of those points that they're going to have impaired literacy, but know that the risk is higher. You want to assess health literacy on all patients. You want to use simple terms, layman's terms, teach back method, understand how they learn, bring in a support person, extra ears, extra eyes to help with the process. Impaired health literacy can be a huge safety piece for the patient. Impaired health literacy can increase med errors. It can increase risk of noncompliance. It can increase the risk of like mistrust in healthcare. It can increase the risk of patients not seeking help with their healthcare. Um, and so we really need to be mindful of that. So strategies, like I mentioned, use plain language, identify those clients who have the lower literacy levels, provide supplemental teaching methods, teach back, give them a scenario of, okay, can you tell me when you wake up tomorrow morning, which medication are you going to take and how, right? Give them a scenario to describe to you to offer the opportunity for you to identify if there's an issue and intervene if needed. Barriers to learning could be present, so you want to know education level, language barrier. So do you have what is their preferred language for learning? Do you have language line interpreters available? And make sure that we're not using our family members for education specific to health. We want to have a certified medical interpreter to do so. Strategies to improve health literacy, like universal precautions. So asking and assessing everybody. Use those non-medical plain language, slower speech. Try to limit the content and repeat those vital points. Get the patient back. Don't do one, like say you have to initiate glucose monitoring with your patients. You're not going to sit down for an hour plus describing every little thing and saying, that's it. See ya. Good luck. Hope it all works out. You're going to follow up. You want to see them again. You're going to give them goals and you're going to give them a number to call and resources if they need help. So that wraps up our week 5 content review. Um, please come to class ready to go over a few case studies to reinforce this information that you have just listened to.